In scenario 1, patient is not suspected of having COVID or is asymptomatic. Therefore, universal precautions can be used. When coming into the faculty practice, one should be going to a room identified as PPE or A3230. In A3230, we will find most of our protective materials. And as I mentioned, for the patients in scenario 1, all that is required is a simple surgical mask that can be placed, as well as protective eyewear. It can be glasses, or in the other scenario, a face mask shield attached to a mask can also be used.
Scenario 2 is where you have a patient who is either infected or is at risk of having the infection, and you're only performing an examination or consultation or follow-up on the patient. The patient will be waiting at the front desk. It's very important that that patient at any time they're in the hospital is wearing a mask, a surgical mask, and that when you go to get him, you place your mask on as well. So once the patient is back in the faculty practice, again, you want to make sure that all three of you are wearing a mask. You will go to the PPE room, or the room that has all of your protective equipment. In this room, you'll find for an examination a yellow gown, your mask you already have on, gloves, and goggles, and put those on prior to doing your examination. Once you've gowned up, make sure any personal belongings are taken off before you enter the negative pressure area. You'll then go into the equipment room, which is the office in the faculty practice, and you will grab the necessary equipment to do an examination. In here, you'll find disposable examination kits, packaged gauze, and if need be, an XCP and a phosphor plate. Once that's done, you can get the person accompanying you or assisting you to check the pressure on the box, making sure that the pressure is always more than or less than 7.5. And it's always important to remember that your accompanying buddy or doctor number 2 will be the one opening and closing the plastic door from the outside. Once the door is open, the patient comes with you into the SAS, or the negative pressure hallway, and you will do the examination in either NP1 or NP2. It's always important to remember that this door remains closed at all times, and that the only time that it should be open is when you are either coming in or out of the room, and you should close immediately behind you. Once the patient goes into the room, you should ask them to wash their hands before sitting down and complete your examination. Once you've completed your examination, you want to make sure that the patient leaves safely and that you appropriately place all used and soiled materials in the right area. Once you're done, you'll ask your patient to stand up and wash their hands for 20 seconds at the hand basin in the examination room. And at that time, you can leave the room. You should note that your gloves will still be on. Therefore, anything you touch after your examination can be contaminated. You're going to come to the hallway. Soiled equipment will be placed in the yellow bin. Once in the yellow bin, you can then remove your gloves, remove your gown, and keep your mask on. And go into the bathroom and wash your hands for 20 seconds using soap. Once that's done, the patient is allowed to leave the room. Doctor number 2 will then, before Doctor number 2 opens the plastic door, the door is closed. Doctor number 2 will then hand a new mask to the patient. The patient will then wear a mask and then be allowed to leave the negative pressure area and will be escorted by doctor number 2 to the exit of the hospital, either on Pine or Cedar. Doctor number 1 can then, if they think they contaminated themselves again, before they leave the negative pressure area, wash their hands again, and then once they're ready to leave, Dr. Tu will open the door and they can leave, and the mask can come off in the equipment room, as well as your goggles, which will need to be cavity wiped and placed back into the PPE room.